When men research vasectomies, they're almost all asking the same question. They want to know how it works. They want to know what no scalpel means, how long it takes, whether it hurts, and how many days they'll need off of work. That's the wrong question. At Vasectomy Clinics in Chicago, we've performed more than 30,000 vasectomies across 5 locations for more than 20 years. And what we've seen is this. The men with the best outcomes didn't just choose the right procedure, they chose the right practice. The procedure isn't what determines how your vasectomy goes. The practice is. By the end of this video, you'll know what separates a vasectomy-only practice from one that added it to a menu. You'll know what questions to ask that almost no one thinks to ask. And you'll know what a good answer sounds like before you book. When a man starts looking into a vasectomy, here's where his attention goes: the procedure itself. He reads about no scalpel technique. He learns that no scalpel means a small puncture instead of an incision, faster healing, less tissue trauma. He reads about no needle anesthetic delivery, which is a pressurized spray instead of a needle. He learns recovery is quicker. He reads that the procedure takes about 20 minutes in an office. He finds forums where men talk about what it felt like and how long it took them to get back to work. By the time he makes his appointment, he knows a lot about the procedure. He knows almost nothing about what separates one practice from another. That's not his fault. The information environment pointed him there. Every vasectomy website describes a procedure in the same terms: minimally invasive, quick recovery, outpatient. The technique name became the thing patients search for, so it became the things practices advertise. Every reputable practice describes it the same way. So men end up reading a dozen websites that all say the same thing. They feel like they've done their research. They've learned about the procedure. They haven't learned anything about the hands performing it. Here's the part men don't realize. The no scalpel approach is standardized. Every practice that offers it uses the same basic method. The tools are the same. The general steps are the same. A practice that does 2 vasectomies a month and one that does 200 both call it the same thing. Same name, same general method. So when men ask, "Do you do no scalpel?" they're asking a question every good clinic answers the same way. But the answer tells you almost nothing about the practice you're choosing. What that answer doesn't tell you is how many times a doctor has performed the procedure. It doesn't tell you whether that doctor has operated on a wide array of anatomy or only the easy ones. It doesn't tell you whether they can adapt when your anatomy is unusual or whether they use the same approach on everyone. The words no scalpel describe a method. They're not a measure of the hands using it. Knowing a practice offers no scalpel vasectomy is like knowing a restaurant has a kitchen. It tells you they can make food. It doesn't tell you anything about the chef. Here's a question that actually tells you something. How many vasectomies has this practice performed? And is it the only thing they do? A doctor who has done the same procedure thousands of times builds something a low-volume practice can't match. It isn't just speed or efficiency. Though these matter, it's the ability to recognize and respond to variation in real time. Human anatomy doesn't look the same in every patient. The vas deferens sits at different depths in different men. The tissue around it varies. Prior surgeries, sports injuries, scar tissue, or a previous vasectomy attempt changes the approach. It affects what the physician can reach. An anxious patient changes the timing and the pacing of the procedure. A physician who has seen these variations thousands of times has a library of responses. They know what difficult anatomy feels like before it becomes a problem. They know how to adjust when a patient's anxiety spikes mid-procedure. They know what an atypical finding looks like and what to do with it. The knowledge doesn't appear in a procedure name. It doesn't show up in a practice's website fact section. But it's the thing that determines what happens when your anatomy isn't straightforward. At a practice dedicated exclusively to vasectomies, one that has performed more than 30,000 procedures, that library is deep. Surgeons who do nothing but vasectomies have seen virtually every variation they've encountered, virtually every kind of anatomy, and every level of patient anxiety. They've handled enough atypical cases to have a specific approach to each one. A general urology practice that does vasectomy as a side procedure can't build that depth. It's not a criticism, it's just math. Volume is time. Time is repetition. Repetition is what teaches what textbooks can't. There's also a focus question. A physician whose day covers vasectomies, kidney stone procedures, and a prostate evaluation is treating vasectomy as one item on a long list. A physician whose entire day is vasectomies is doing something different entirely. The mental and physical attention they bring to your procedure is different. The preparation before you walk in is different. The systems built around your care are different. When vasectomies are the only procedure we do, focus compounds over time the same way volume does. If you have any questions about how to choose the right practice, leave it in the comments. We read every one, and the answers are usually more direct than what you'll find on a clinic's own website. When a practice does one thing for 20 years, it builds more than experience. It builds the systems and standards that a general practice offering vasectomy as a side service never develops. The consultation is the clearest example. At a practice dedicated exclusively to vasectomies, the consultation is a focused exam. The physician finds the vas deferens on each side, maps the anatomy, and accounts for prior surgical history. The surgical approach is built before the procedure is ever scheduled. At practices where vasectomy is one of many services, the consultation is often just paperwork, a form, a brief conversation, a procedure date. The physician meets the patient for the first time when he's already on the table. The surgical approach gets decided in the moment instead of in advance. Men who've scheduled or attempted vasectomies elsewhere and then come to us are sometimes surprised that we examine them at the consultation. They assume the examination happens at the procedure. At a practice where vasectomy is offered as a side procedure, it often does. That's the difference between a practice built around vasectomies and one that has simply added it to a list of existing services. The pre-procedure experience is another example. At our practice, every patient speaks with our team by phone before they come in. By the time they sit down with a physician, they already know the cost, the recovery timeline, and what to expect on the day of the procedure. They know they'll need a ride to and from the procedure. The logistics are handled before the clinical appointment. That way, the doc can spend quality time with the patient and perform a careful exam. And the post-procedure process is another great example of the strong systems and standards we've developed over the last 20 years, such as our post-vasectomy semen analysis. At our practice, we track where every patient is at in their confirmation process. We follow up directly. Some men who come to us after attempting a vasectomy elsewhere didn't even know they were supposed to have a semen analysis at all. They were told once at a discharge and it didn't register. Since our practice does vasectomies exclusively, that follow-up is built in because we know what happens when men skip it. So here's what to do with all of this. When you're evaluating practice, the questions that actually differentiate one practice from another aren't only about the technique. They're about volume and focus. Ask how many vasectomies the practice performs per year. A practice doing over 1,000 vasectomies a year has built something completely different from one doing a few dozen as part of a general urology practice. Ask directly. The number matters. Ask whether vasectomy is the only procedure the practice offers, or one of many. A practice that only does vasectomies has made a different commitment than one that offers them alongside everything else. That difference shows up in the consultation, the surgical approach, the patient experience, and the success of the procedure. Ask what the consultation actually involves. Does the physician examine you? Does the exam happen before the procedure is scheduled? Or does the surgical approach get determined the day of? A practice doing this right will describe a real physical exam. The physician finds the vas deferens on each side and maps the anatomy before any scheduling happens. Ask what happens if the physician finds something unexpected at the consultation. A practice with genuine depth will have a clear answer. Unexpected findings come up in this procedure. A practice that's done 30,000 of them has seen those findings before and knows what to do. Ask how the practice confirms the procedure worked and what the follow-up process looks like. 2 semen tests, both clear. A process that's tracked, not left to the patient to remember. Pay attention to what you hear back. A practice doing this right will give you specific numbers and a clear description of the consultation process. If the answer to what does the consultation involve is, we'll go over everything when you get in, that's a sign the consultation is paperwork, not a thorough medical history and physical exam. If the number of annual vasectomies is vague or deflected, that's information too. If a practice can't or won't give you a specific answer to those questions, that tells you something important. And it's good to know that before you're on the table. The right practice answers all of them without hesitation. If you've already scheduled with a practice and you're not sure you asked these questions, it isn't too late. Call ahead before your appointment. Ask about the consultation process. Ask how many vasectomies they perform annually. Ask what the post-procedure follow-up involves. The answers you get before the appointment tell you what kind of experience to expect during it. And if the answers still concern you, you still have time to choose differently. Most men don't realize they can change course before the procedure date. They can. Most men walk into this choice knowing a lot about the procedure and almost knowing nothing about the practice performing it. Now you know which questions actually tell you something. The procedure is standardized. The practice isn't. Volume, focus, 20 years of doing one thing. That's what separates a practice built specifically for vasectomies from one that added it to a menu. Ask those questions before you book. If you want to know what happens at the consultation and why the exam matters so much, we have a video on that. It's called Before You Book a Vasectomy, Watch This.